Donna Meldon, Executive Director for the Holmes County Chamber of Commerce, and this is Chats with the Chamber Lady. Today's guest is Isaac Becker with BIG Medicare Solutions. Hi, Isaac.
Hey, Donna. How you doing?
Welcome.
Thanks for having me.
Let's go ahead and get started. Tell me a little bit about yourself, Isaac.
Sure. So I've been in the Medicare arena here for roughly the last 15 years. Started up originally where I'm from in Ohio. Was there for about 5 or 6 years. Ended up moving a little bit further south. Went to Nashville for a couple years, and then I've been down here now. Be going on 11 or 12 years, I think, in February. Still been doing all of the Medicare plan choices for seniors and folks like that. Just finally figured out this is home base.
And you, of course, have done that for my family, myself this year. I've just exposed my age, but it is a very much needed service for our seniors in our community, and you do such an excellent job.
Very much so. I mean, there's close to 5,000 Medicare recipients here in Holmes County. There's 4 million here in the state of Florida, and we're approaching 65 million nationwide. And so by 2030, we're looking at that number to hit 80 million.
Let's go ahead and talk about Medicare. What is Medicare?
Yeah, so when anybody's starting at their first principles are 0 point, okay? You know, Medicare starts when you turn 65, okay? That's the most traditional route. Folks will age in, okay? Other folks that have a disability, okay, prior to 65 may get Medicare, okay? And then other qualifying health events, maybe you have end-stage renal disease or you're blind, or certain qualifying events will allow folks to get on Medicare prior to age 65.
Okay. And now the enrollment periods, I know that they're pretty much here, but go ahead and talk about, the enrollment periods available to Medicare recipients.
Yeah. You have your initial enrollment period. Those are 3 months prior to turning 65. That's when everybody, like yourself, just here over the summer, everybody was beating on your door, probably calling you, sending you stuff in the mail, everything else like that prior to 65. So those are all the suitors coming to you first. October 15th. To December 7th. That's the big one. That's when everybody is calling you or trying to get in contact with you to let you know what changes are going to be going on. Okay. That'll be my big season here coming up in a couple weeks, where I'll be working 14-hour days for the next 9 weeks.
Right. Longer,
yeah, exactly. I'll be disappearing, running out, having people in. And then you have that election period, the 3 months or 90 days after the enrollment period at the beginning of the year, starting from January 1st till March 31st. That's essentially an election period where, let's say, an individual has maybe buyer's remorse, or let's say they made that decision by themselves and say, hey, I want to go back to my previous plan.
Okay.
Or maybe they found out, hey, there's another plan that is more suitable for me. I would like to elect to go into that plan. Okay. So you have those periods.
If anyone is starting the process of understanding Medicare and how their benefits work, what are the first principles do they need to understand in choosing a secondary insurance?
So your Part A is your hospitalization, all right? So you get that whenever you turn 65, okay? Your Part B is any non-hospitalized service. So, and that Part B will have a premium that's associated, okay, with that. You can opt in, okay, to that Part B. I would recommend anybody that does not have any type of secondary insurance, okay, whether you're a retiree or currently working and they're giving you credible coverage or insurance, to have that Part B. And then Part D is the prescription drug benefit, okay? In 2006, there was legislation that was passed to where you were required to have prescription drug coverage, okay? And so now Part D, essentially in the last few years, I want to say probably before COVID, they have now started auto-enrolling Medicare recipients into a prescription drug plan, just because they want to avoid folks not having that prescription drug coverage, because if they opt out of that or don't start when they get Medicare, there's a penalty that's associated with that.
Now, what incentives or benefits are available to folks who enroll in the Medicare plan?
When you start on original Medicare, all right, there's 6 gaps, okay? There's 3 on the Part A, and then there's 3 on the Part B side, okay? So if you just say, hey, I'm going to do nothing and just have original Medicare, okay, they are going to pay those services for your Part A and your Part B. But the 3 gaps that we're focused on the Part A is going to be a hospital deductible, okay? So if you get admitted or go inpatient, you're going to have a copayment. This year for 2025 was $1,676. So you go right in, you're going to get that bill.
You're going to have to pay
correct
up front.
Okay. The other 2 that are more rare is if you have a hospitalization stay that's over 60 days. Very rare that happens. They now, at that point, at day 61, they will assess a daily copayment for each day from days 61 to 90. Here for 2025, that's $419. Okay? A day. Yeah, a day. Like I said, very rare that happens where you're in the hospital for, 60 days.
Right.
And then once you get past that 90th day, they have another copayment that, again, very, very rare. It's $838 for a lifetime. Okay, so then you have a lifetime reserve.
Okay.
Okay. And then the final thing is going to be skilled nursing. So if you exceed your first 20 days, Medicare is going to pay the first 20. So let's say, hey, you have a hip replacement surgery and you need to go to a rehab facility. Usually those folks there, that is their niche. That's what they do. They're there to, get you rehabilitated to make sure you go home. Like, the hospital's not going to cut you loose and let you go home. Say, hey, we need to build up that strength, or hey, we need to get you back to this point. You would go to that skilled nursing facility. And then that copayment over there is going to be $209.50. The Part B is, again, a little bit different here. So that first one is the annual deductible of $257, and then it goes to that 80-20 split for services. Medicare is going to pay the first 80%. You're going to be responsible for the other 20%. And so this is where it gets kind of dangerous for a lot of folks, as opposed to if folks know and have had insurance in the past previously, they know that they may have we'll just say a $200 copayment, right, for an MRI, all right? But if you go in and get an MRI and they're charging, $2,500, $3,000, you're paying 20% of that. So again, the value of having that insurance, whether you were employed or whatever the case is, limits that risk or liability for you. Okay.
Exactly.
And then the third one is an excess charge. Very rarely does it happen. It just allows a particular provider, if they choose to incur an excess charge where they can charge you up to another 15% for a service done. So those are your 3. So six gaps when you're starting out on original Medicare, 3 on the Part A side, 3 on the Part B side.
Okay. Now, what are the differences between Medicare Advantage or Medicare supplemental plans? And that would be your supplement or secondary.
Yeah, your secondary insurance. Bingo. Yeah. So again, starting from 0, now we have that fork in the road. All right, of saying, hey, I have Medicare. Let's say I'm 3 months out, and I'm lost. I don't even know where to start.
That would be me a few weeks ago when you spoke with me.
Right. They send out the big Medicare and You book. They do that every year. So having somebody that you can sit across the table with, like what we're doing now, to educate somebody, walk them through this process today. And that's kind of what we're doing here today, is kind of giving, folks out here that are listening today really a broad brushstroke, but of a lot of kind of information of going step by step on these things. How Medicare Advantage works is you have your original Medicare, okay, and then the secondary plan, the Advantage plan, okay, is a managed care model. So it bundles the A, the B, and the D together, okay. The vast majority of those plans have a 0 premium. They've consistently started to come down. A lot of plans when I first started out, you had X amount of dollars. It might be $40 or $50 or whatever, just to have access to that secondary plan. Okay. But again, that bundles that A, that B, and that D. Okay. And that helps eliminate, all right, your 6 gaps that we had talked about
in the original Medicare. Okay.
Yep.
Now, we're gonna shift to the state funded health care, which of course is Medicaid. So talk a little bit about Medicaid, and then can your customers have both if they need it?
Yeah. So Medicaid is, again, that's state insurance. So those restrictions or how that's managed is state by state. Okay. So usually that's based for poor folks. Okay. That meet an income requirement.
Right.
They can apply to get that assistance, usually through a children and family or a local Medicaid office to see if they're eligible for that. Okay. Those folks are what we call in the business duals. Okay. Meaning they have both Medicare and Medicaid. Okay.
Now, what are some of the pitfalls people have by just choosing their plans on their own? And I'm sure there's a lot of people out there that do that.
Yeah, we have quite a bit.
You see all these commercials on TV. It's like, and it's amazing because, I was anticipating signing up for Medicare, and it is just, you hear all kinds of advertisements.
Right.
And you don't know if they're credible programs.
It's gotten... let me try to be as generous as I possibly can here. Okay. It's gotten pretty insidious over the last 5 years prior to COVID. When I say that is, if let's say you wanted to enroll and you already knew, hey, I'm 100% confident I want to enroll in this particular plan. Okay. The only option that you had prior to COVID is you had to pick up the phone and call the insurance carrier directly. They had their own telesales team that would handle the process. They would walk you through everything. Okay. They would do the full assessment like they do. All that stuff's recorded. So, CMS regulates all the carriers just like me, everybody else. And so they would go ahead and just walk you step by step through that. Okay. When COVID hit, brokers like myself that are usually doing this type of interaction with folks face to face, we couldn't do that because obviously everyone was terrified of the current situation that was going on, and the administration at that point in time allowed brokers like myself to do telephonic enrollment applications. Okay, which is great for the brokers as well, and again for usually the members and the clients, because hey, I can still get the information that I need from my agent and or broker. And, that's great. But what had happened then at that point in time is you kind of, open the box up for a lot of roboers, okay, that are there for, at the very worst, siphoning information, okay, that they can either package up and resell, and then you take that risk when you initially made that phone call. They get that information to you. Now they package it and then they resell it. And now that's why you have 20 people calling you a day.
My husband, he several years ago, whenever he was signing up for Medicare, I mean, you have him in such an appropriate plan for his health, and you are very trusted. And I'd just like to recommend to everyone that it means so much to have that trusted agent and to be able to call you. And I signed up, and then I had to call you back, and it's like,
right.
Okay, what about this?
Yeah.
So you have a dependable person that you can trust, and that can answer all your questions.
Right. That's the name of the game. The currency in my business is trust, because you can get it wrong as many times on your end as you want. If I'm building trust and building a business here, I got to get it wrong one time.
Yes.
And then that erodes that trust. So again, And just kind of hit the nail here on this last point as well is all of my clients every year get an annual assessment. Okay.
Yes.
The vast majority of folks, especially if you're doing anything telephonically with a broker or a carrier, maybe they're somewhere else or not even in the state. Those folks usually do not have. Again, what's the generous way of saying this? They're not going to have that follow up to keep you in the loop from year to year to year, and so
and your health changes.
Correct.
From month to month. So it's very important that I think an assessment is done because, everything changes so quickly, especially as you age. So it means a lot. Now, should a retiree, say if someone is a county school board employee or someone in the private sector, should they enroll in a Medicare plan, although they might have an insurance plan too?
That's going to be a little bit more complicated of an answer. That's going to be back to, like you were saying, that individual assessment for sure. You really kind of want to quadrant 4 groups of individuals. You have your originals that kind of age in. You have your group employees that you're just mentioning. And then you also have VA folks as well. And then you might have, let's say, a retiree kind of package or whatever if they're currently working. So those are kind of your 4 quadrants. And some of those overlap too. You might have Medicare and VA, or you might have Medicare and you're 66 and you're still working, right?
Right.
Hey, I got a great job. I'm doing great. I don't need to opt into my Part B yet. So those are all those types of questions that should be asked to those individuals that are actually exploring whether they want to drop or decline their either group or retiree coverage and maybe opt into an individualized Medicare Advantage or Medicare Supplement plan. So, again, like I said, a little bit more complicated, but, going through the assessment that I do and going through those right steps of asking the right questions and, hey, what are we really solving for?
Right.
Okay. That's the big thing.
Now, what are the types of changes here locally in the Holmes County area to the Medicare landscape this year in 2025 and 2026?
This year was the first year that they have implemented eliminating the donut hole. So what that means for individuals is you're capped now at $2,000 out of pocket total for the year for all of your medications. Okay. They also implemented something that I thought was really important for a lot of individuals too, because let's say you're taking 3, let's say, name brand medications. Okay. And so those are going to be, they're going to whack you really hard at the beginning of the year. Medicare allowed, if you were able to, let's say, again, I'm using just a general number here, $600. Okay. Let's say that's what the pharmacist charged you. Okay. It was $600. They allowed you to essentially pay 25% of that. They would obviously give you your medications, but then they would prorate that bill. So the remaining $450 over the remaining 11 months or whatever month you went in to pick up your medications. Okay. And then any other type of, co-payments or anything else like that, again, kept up with what you were paying, but essentially a payoff kind of plan at the end of the year, but they capped it at $2,000.
Anything you might like to add, and also contact information. How can someone reach you, Isaac?
Yeah, so I'm here locally. I have an office in Bonifay, right there on Waukesha 116.
BIG Medicare Solutions.
Yeah, it's got the sign. It's lit. We got it. Still working on some window inserts that we're trying to get put up there, just to get have a little bit more attention to the office. If the open sign's lit and the lights are on, I'm there. If not, you can always call, make an appointment. I have a Facebook business page as well.
Okay. Isaac, I can't tell you just a feeling that you get when, as myself and my husband, somebody that we can trust, and somebody who, if we reach out to, you return the call quickly as possible.
Right. Yeah.
And that's a good thing for our community. So I just appreciate everything you do for our senior population. Of course, you help so many people, and we're just glad that you're here in our community. I thank you so much for being our guest today, Isaac. And this is Donna Meldon, Executive Director for the Holmes County Chamber of Commerce. And this has been Chats with the Chamber Lady. And remember, if you need it or you want it or you want to do it, it's right here in Holmes County. Thank you so much, Isaac, for being here today.
Thank you, Ms. Donna. Appreciate you.